Hello and welcome. Today we're diving into the world of respiratory health to explore a common condition, acute bronchitis. We'll uncover what it is, what causes it, how it affects your body, and what you can do about it. So, let's take a deep breath and get started. Acute bronchitis is often caused by viral infections. These are usually the same viruses that cause the common cold or the flu. Less commonly, bacteria can be the culprit. Irritants like smoke, dust, pollution, and chemical fumes can also inflame the bronchial tubes, leading to acute bronchitis. Essentially, anything that irritates or infects the lining of your bronchial tubes can potentially cause this condition. Now, let's understand what happens inside your lungs when you have acute bronchitis. The bronchi, or bronchial tubes, are passageways that carry air to your lungs. When these tubes become inflamed, their lining swells and produces mucus. This narrows the airways, making it harder to breathe and causing you to cough. The increased mucus production is your body's attempt to trap and remove the irritants or infection, but it also contributes to the discomfort. Acute bronchitis is incredibly common, especially during the colder months coinciding with flu and cold season. It affects people of all ages, but is more prevalent in children under the age of 5 and adults over the age of 65, people with pre-existing lung conditions, such as asthma or COPD, and those who smoke are also at higher risk. The symptoms of acute bronchitis can vary from mild to severe. The most common symptom is a persistent cough, which may or may not produce mucus. Other symptoms include sore throat, runny nose, fatigue, shortness of breath, wheezing, a low-grade fever, and chest discomfort. These symptoms often resemble those of a common cold, making it sometimes tricky to differentiate between the two. Diagnosing acute bronchitis typically involves a physical examination and a review of your symptoms. Your doctor will listen to your lungs with a stethoscope to check for wheezing or crackling sounds. In most cases, further testing is not needed. However, if your symptoms are severe, or if your doctor suspects pneumonia or another underlying condition, they may order a chest X-ray or sputum tests to rule out other possibilities. While there aren't distinct types of acute bronchitis, it's helpful to classify it based on its cause. We can distinguish between viral bronchitis, bacterial bronchitis, less common, and irritant-induced bronchitis. Identifying the cause helps guide treatment decisions. Bronchiolitis is a similar condition, but it primarily affects young children and infants. Treatment for acute bronchitis focuses on relieving symptoms. Since most cases are caused by viruses, antibiotics are usually not effective. Common treatments include rest, drinking plenty of fluids, and using a humidifier to moisten the air. Over-the-counter pain relievers can help with fever and discomfort. A cough suppressant might be recommended if coughing is interfering with sleep. In some cases, bronchodilators may be prescribed to open up the airways, particularly if you have asthma or wheezing. Preventing acute bronchitis involves practicing good hygiene. Wash your hands frequently, especially during cold and flu season. Avoid close contact with people who are sick. If you smoke, quitting is one of the best things you can do for your respiratory health. Also consider getting a flu vaccine each year to reduce your risk of viral infections. The prognosis for acute bronchitis is generally good. Most people recover within a few weeks. However, the cough may linger for several weeks, even after other symptoms have subsided. While acute bronchitis itself doesn't usually cause long-term complications, it can sometimes lead to pneumonia, especially in vulnerable individuals. Research is ongoing to develop more effective antiviral medications and to better understand the long-term effects of respiratory infections on lung health.